Hey everybody, and welcome back to Sassy Muskoka. Today I wanted to take a little bit of time to talk about self-care and mental health awareness. It's something that I'm struggling with right now and something that my kids are struggling with right now. And I just wanted to take a little bit of time to sort of share my story and to let you know what I'm doing to help get through every day. So to start with, I talked to a counselor every week, and the counselor suggested that I start trying grounding techniques, which is something new to me. I was diagnosed over 20 years ago, and I've been on medication since, and I've done cognitive behavioral therapy, but I haven't done grounding techniques. So it's definitely something that I keep practicing. It's a simple set of strategies to help detach you from emotional pain. So a lot of people with PTSD use this. As many of you know, I'm a nurse. I'm not a doctor. I'm not a therapist. I'm not a counselor. Everything that I'm talking about today is my own opinion and what works best for me. And I just thought I'd share that with you. And also as a nurse, self-care is definitely at the bottom of our list. The first thing we do when we're at work is take care of patients, not ourselves. And then we go home, and the first thing we do is take care of our family and not ourselves. My children are struggling right now, and being off work, being able to focus on trying to be able to cope has really helped me. Back to the grounding techniques is the 5-4-3-2-1 technique. So 5 things that you can see. So looking around my room, I see a picture, I see a fan spinning, I see the mail, I see a barbecue lighter, and I see a broom. For things that you can feel, I can feel my flip-flops on my feet. I can feel my necklace on. I can feel my hair against my shoulders. And I can feel the breeze from the fan that I have going. Next is 3 things that you can hear. So I can hear the wind outside. I can hear the fan. And I can hear the cat playing upstairs. The next is 2 things that you can smell. So I can smell a candle that I'm burning. And I can smell my deodorant. And number 1 is 1 thing that you can taste. So I just had some gum, so right now I can taste peppermint. Something that can be done anywhere at any time, and I'm hoping that once I get back to work, that if something triggers me to not be able to cope, that's something that I can do quickly, go into the back room, take a minute, focus, and then get back to what I'm doing. The next thing I'm doing is Nar-Anon meetings. So I do 2 Zoom meetings a week right now. And it's actually a 12-step program for family and loved ones with people who are struggling with drugs. And that's really helping me because people are actually going through what I'm going through. The second part to that has been tough because you hear stories of maybe people who have more of a struggle than you. And you think that you have it bad, but then you go to the meetings, you hear how other people are struggling, then you realize that we're kind of all in the same boat, and maybe other people's stories are harder than yours. It's just how you are able to cope with them. So I have found that beneficial. It gives me something to focus on as well. The third thing that I've been doing is actually self-care. So, I don't wear a lot of makeup, so some days I'll put makeup on, like today. It makes me feel better. I did my hair. I might go for a walk with the dog, do my nails. I find that reading helps as well. So go into the sunroom or down to the lake and read a little bit of a book. It sort of takes you away from where you are in the moment right now. I wouldn't be able to do this without the support of Keith and my loved ones and my friends. Struggling with my children's mental health has been very hard for me. It's hard to disassociate me being the mom and me having a mental health illness and then being able to function past that. So I just hope that this video finds you well, and that maybe these tips and tricks that I'm trying can work for you if you're struggling. Please feel free to reach out to me. Once I've started these Zoom meetings, I'm a little more open to talk about my illness and my children's. I guess I want to talk about my bullet journaling as well. So I started bullet journaling around the beginning of August when I first went off work. And one of the things that helps me the most right now is the mood tracker. So I fill out the bubble with however I'm feeling that day, and sometimes it could be a couple of feelings. Lately it's been depressed, sad, and tired. There's the odd happy day thrown in there, so that's good. But being able to have a visual of how my mood has been over a month has been helpful to me, and I can journal about it if I've had a really bad day or a really good day. The other part of the bullet journaling that helps is the highlights of the day. So it makes me focus on something that's happy or good. And I found that to be very beneficial. Please feel free to reach out to me if you have any questions, and we'll see you in the next video. Have a good day.